Hey Bentonville, if you are dealing with low back pain, we got a treat for you here. What I'm going to do is teach you what we do in our practice to supplement the adjustment in order to help you out with your low back pain. Hey, my name is Dr. Ryan Carlson. I'm with Deep Roots Health Center right here in Northwest Arkansas in Bentonville, and we are going to show you something called Spinal Hydration Therapy. So this is my lovely office manager, Segan, and she's going to be our model today. So what the Spinal Hydration Therapy does is it's done on one of our spinal hydration discs, and it actually works to warm up the spine, get you ready for a good adjustment, but it also brings fluid back into the disc spaces, which is a really important thing for most of our low back patients. Because when you can bring that fluid back into the disc space, that's the cushion between each of the vertebrae. When you have that proper amount of fluid, it takes pressure off of the nerves and it helps you to function at your absolute best. So it's the perfect supplement for the adjustment. So with the Spinal Hydration Therapy, it's a few specific movements, and it is very specific to each patient that comes in. So some patients may do certain moves while others do different moves. It just depends on what your specific x-rays show and what the exam findings were. So I'm going to have Segan go ahead and take a seat on the spinal hydration disc, and she's going to go through the different ranges of motion for her specific case. So let's start with side to side, and we'll show the viewers what that looks like. So she's bending all the way to the side, getting as much motion as possible in those hips, and that's what really puts that fluid back into the disc spaces, is that motion. So that's one move for her. The second one that we do for her is we go side to side. And again, it's getting that full range of motion in there. Again, it's warming up the spine so that she's ready for a good adjustment. But what it also does is it brings that fluid into the disc spaces, plumps those up so that she can function at her absolute best. And then the last one is forward and backward.
This one's my favorite.
This is her favorite. So she sucks that belly button back towards the back of her spine and then extends all the way back. Most of us are in this forward posture many different times throughout the day. So when we can extend all the way back, that's what gets you those good results. So if you got something out of this video, make sure that you comment, tag, or that you share below, and we will catch you on a future video.